Systolic blood pressure is related to two main factors. One is cardiac factors and the other is vascular factors. Cardiac factors are those that are related to the heart. These include LV contractility, heart rate, cardiac output, and blood volume. If any of these increase, it will lead to an increase in our systolic blood pressure. And the two vascular factors, which have two important components, one is arterial compliance and the other is arterial resistance. We said that the greater the arterial compliance, the lower the systolic blood pressure, and the higher the arterial resistance, the higher the systolic blood pressure will be. From the combination of these factors, a formula has been derived called Poiseuille's law, which states that blood pressure equals cardiac output multiplied by resistance, where resistance refers to vascular resistance, as we mentioned, which is exerted at the level of the arterioles. Cardiac output is equal to heart rate multiplied by stroke volume, meaning the volume of blood that leaves the left ventricle and enters the arterial system. To put it more simply, systolic hypertension occurs when either the input to the arterial system increases, meaning that cardiac output is higher and in fact a greater volume of blood enters the arterial system, or on the other hand, the output from the arterial system decreases. In other words, resistance has increased. And the combination of these two factors leads to systolic hypertension. And based on this, the medications given to regulate blood pressure act precisely on these components. For example, diuretics are prescribed to reduce blood volume. Beta blockers are prescribed, which decrease LV contractility and cardiac output, reduce heart rate, and as a result, lead to lower blood pressure. Or, on the other hand, alpha blockers or ACE inhibitors are given, which both reduce circulating blood volume and decrease vascular resistance at the level of the arterioles.